Millions of Americans woke up to the news President Trump and First Lady Melania Trump have both tested positive for COVID-19. And tonight here we have just witnessed a remarkable image. The president leaving the White House giving a thumbs up, wearing a mask. White House staff wearing masks as well. This was the president just moments ago. Marine One then carrying the president from the White House to Walter Reed Medical Center in Bethesda, Maryland. The White House saying his doctor and medical team suggested the move as the president now fights this virus, saying this move is out of an abundance of caution. But we do know he is showing some symptoms. It was just before 1 this morning when the president tweeted the news that he and the First Lady had tested positive. The White House physician then quickly saying that the president can carry out his duties, quote, without disruption. The news coming after we first learned that the president's top aide, Hope Hicks, had tested positive Thursday morning. Hicks by the president's side as he traveled to many events in recent days. 7 rallies in the past 12 days, including Wednesday night in Duluth, Minnesota. And of course, Tuesday night's debate with Joe Biden together on that stage for 90 minutes, socially distanced. But there was also immediate concern with this news for Joe Biden's health, too. This morning, reporters waited for hours before learning Joe Biden's test had come back negative. His wife, Jill Biden, negative, too. So we're going to carefully guide you through it all tonight, beginning with this late move, taking the president to Walter Reed Medical Center. And here's our chief White House correspondent, Jonathan Karl.
A sign of just how serious the president's condition is. He was taken via helicopter late this afternoon to the Walter Reed Medical Center. Multiple sources close to the president say he is experiencing the signature symptoms of COVID-19: fever, chills, nasal congestion, and a cough. The White House released a statement from the president's doctor saying he has been treated with a, quote, polyclonal antibody cocktail, as well as zinc, vitamin D, famotidine, melatonin, and a daily aspirin. As of this afternoon, the doctor wrote, the president remains fatigued but in good spirits. He's being evaluated by a team of experts, and together we'll be making recommendations to the president and First Lady in regard to the next steps. Earlier, Chief of Staff Mark Meadows provided few details on the president's condition.
The president does have mild symptoms. He continues to be not only in good spirits, but very energetic.
Remarkably, Meadows, who has been in close contact with the president, addressed reporters without a mask. So did Press Secretary Kayleigh McEnany, who refused to elaborate on the president's health or how he was tested.
I'm not going to get into the president's symptoms exactly. I'm not going to get in exactly what type of test.
The president himself has gone silent. The last word from him, a tweet shortly before 1 a.m., where he announced that he and the First Lady had tested positive. His public schedule included a phone call today to discuss protecting seniors from coronavirus, but Vice President Pence handled the call instead. Last night, President Trump told Sean Hannity he was waiting on test results after learning one of his very closest aides, Hope Hicks, had tested positive. He implied Hicks had been infected by a member of the military or law enforcement.
You know Hope very well. She's fantastic, and she's done a great job. But it's very, very hard when you are with people from the military or for law enforcement, and they come over to you, and they want to hug you, and they want to kiss you because we really have done a good job for them. And you get close, and things happen. I was surprised to hear with Hope, but she's a very warm person with them, and she knows there's a risk.
Hicks had been at the president's side all week. Tuesday, she was at the debate in Cleveland, where members of the president's family sat in the front row without masks. Wednesday, she traveled to his rally in Duluth, Minnesota. You see her here walking to Marine One without a mask, Jared Kushner right behind her. She touches the handrail, and then so does he. At the rally, President Trump tossed hats to his supporters. And sources tell ABC News Hicks was starting to experience symptoms. On the ride home, she was quarantined on Air Force One. ABC's Jordan Phelps was on that flight and saw Hicks exit through the back.
It was striking because at the time she was wearing a mask. It was striking because Hope Hicks never wears a mask.
Sources tell us Hicks tested positive yesterday morning. The White House won't say when the president found out. Meadows told reporters his team sprang into action just as Trump was heading out to a fundraiser in New Jersey.
In terms of Hope Hicks, we discovered that right as Marine One was taking off yesterday. We actually pulled some of the people that had been traveling in close contact.
But they didn't pull the president off the chopper. He went on to meet with about 100 supporters at his Bedminster resort, even though he knew he'd been in close contact with Hicks. The governor of New Jersey is now urging anyone who was there to take precautions.
We urge everyone who was in and around the Bedminster event or events yesterday to take full precautions, including self-quarantining and ultimately getting tested.
Hours after the fundraiser, the president appeared via a pre-recorded video at New York's traditional Al Smith dinner and declared the COVID crisis all but over.
I just want to say that the end of the pandemic is in sight.
Then, just 6 hours later, he tweeted out his own test results. The First Lady and I tested positive for COVID-19. We will begin our quarantine and recovery process immediately. We will get through this together. This morning, the First Lady tweeted she was experiencing mild symptoms. The White House doctor said Mrs. Trump has a mild cough and headache. Now the White House is scrambling to track down everyone who's been in contact with the president, the First Lady, and Hope Hicks. It's not an easy task. Over the past several days, the president has held one large-scale event after another with no social distancing and very few people wearing masks. On Saturday, hundreds of supporters jammed into the Rose Garden as he announced his Supreme Court nominee. Utah Senator Mike Lee was there, caught on camera hugging one person after another. Today, Senator Lee announced he had tested positive. Also in the crowd, the president of Notre Dame, Father John Jenkins. He wasn't wearing a mask either, and today he tested positive for COVID too. Tuesday, the president and his entourage traveled to Cleveland for the debate, where he mocked Joe Biden for wearing masks.
Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen.
Wednesday, as he headed out to his rally, he shouted answers to reporters' questions. But the president cut that rally short, and sources tell ABC that top aides noticed he appeared exhausted and fatigued. Some figured he was just tired. Others worried he may have been exposed to COVID-19.
So let's get to John Carl. He's live at Walter Reed Medical Center tonight. And John, I know you're learning more about the president's condition. Of course, he arrived there just a short time ago. What can you tell us about the symptoms he has so far and why this move?
He arrived just a short time ago. We saw the helicopter land, Marine One land right over there. The president walked out, went into a car, and was taken into the medical center. We know very little, frankly, about his condition. The press secretary said that he will be working out of the presidential offices here at the Walter Reed Medical Center for a few days. Regarding his condition, what we have learned is that he has those signature symptoms of COVID-19, low-grade fever, chills, nasal congestion, a cough. We also have been told from the physician, the White House physician, that Melania Trump, the First Lady, has a mild cough and headache. The other members of the First family, thankfully, have tested negative for COVID-19. We are told they are in good health. David?
John, I know you've been on this all day long. We really appreciate it. We'll come back to you if you learn anything more. And in the meantime, we do have more on the president's condition tonight. Dr. Ashish Jha, the dean of Brown University School of Public Health, he's here. So is Jen Ashton, our doctor, in the building. We'll go to her in just a moment. Dr. Jha, first, I wanted to ask you about this move to Walter Reed Medical Center. And of course, the symptoms you've heard so far, John just mentioned them: fever, chills, congestion, cough, and his own staff noticing the fatigue. But this actual move, when combined with those symptoms, what does it tell you?
Yeah, so thanks for having me on. You know, obviously, anytime the president is moved to a hospital, that's a concerning situation. My sense is that they're going to have a low threshold for getting him there. So we don't know a lot, and we're going to have to watch what happens. I'm particularly interested in what his oxygen level is like, what his breathing is like. We'll have to pay close attention to that.
And Dr. Jha, you've talked about the other factors. You said the president's age, his weight could also play into this.
Absolutely. He is clearly in the high-risk category. He's in his mid-70s. He is overweight. We don't know about his comorbidities. All of that makes him a high-risk person for this infection, particularly concerning and really needs us to pay close attention.
Dr. Jha, stick with us here. I want to bring in Dr. Jen Ashton on the phone with us tonight. And Jen, you know the president, it was reported late today, has been given a cocktail of experimental antibody treatment. What more can you tell us about this cocktail and what that might do?
Yeah, David, this is an infusion. It's not a pill, and it's a combination of several antibodies synthetically made. So this is similar to the convalescent plasma that we've heard about coming from other patients, only these are made in a lab. They target that spike protein and actually shut down the viral replication and improve people's symptoms. So in a small trial of 275 patients, it was well tolerated, had some good results, and preliminary data is looking good. And this is an interesting option for patients who are not hospitalized, although obviously we are seeing this particular patient become hospitalized.
Dr. Ashton, thank you. And Dr. Jha, we're just, what, 24 hours, not even 24 hours into this move, as you mentioned, the bar very low to make sure the president is getting the care that he needs, this move perhaps. But what can you tell us about what you've seen in this virus around the country? We're in the very early stages. Sometimes we don't even see the depth of the symptoms until 4, 5, 6 days into this.
Yeah, so I think one part of this that's a little concerning to me, and I don't want to overstate this because we don't know a lot, is how quickly this is moving. He was just diagnosed yesterday, and he clearly has deteriorated today. We don't know how serious he is. It was good to see him walking by himself, but this is a little unusual. Usually it takes more days before people get much sicker. So again, keeping a close eye and looking for some data would be very helpful.
All right, Dr. Ashish Jha and Dr. Jen Ashton, both with us tonight. Our thanks to you both.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.